This October and every October is Breast Cancer Awareness Month, but we want you to be educated no matter what time of year it is. Dr. Lindsay Weintritt-Davis from Bay Radiology Women's Imaging Center is here with us, and we know that screening mammograms save lives.
Absolutely.
And when we talk about screening mammograms, some people say, oh, well, I've been told I have dense breast tissue. What does that mean?
Right. So dense breast tissue is an important point to consider, and it's individualized per patient. The density of your breast is determined based on the appearance of the mammogram. So it's not anything that is knowable until you've had your first mammogram. And when the radiologist looks at it, they will categorize your breast density into one of four categories. And sort of the top two categories, which we call heterogeneously dense or extremely dense, are considered dense breast. And that's important for a couple of reasons. Number one, the dense breast tissue, the way that we determine your breast density is we look at how much fibroglandular breast tissue. It's just the makeup of the breast. And that fibroglandular breast tissue is white, but cancers are also white. So when we look at a mammogram, which is an x-ray of the breast, it's just a black and white picture, the more of that white dense breast tissue present, it could hide a breast cancer. It makes it more difficult to see. So in those patients, we know that the mammogram is limited. It's much more successful to see a mammogram when there's less, or a breast cancer when there's less of that dense breast tissue present. So patients actually now, there's been a big push to educate patients about breast density so that they can advocate for additional screening, which we know is appropriate in patients with dense breast tissue. So when you see your mammogram report or get the letter in the mail with your results, now in Florida it's required that every patient is notified you have dense breasts or you don't have dense breasts, so that they are at least aware and can seek out additional screening if they choose to.
So when people see that on their report, it's not necessarily cause for alarm, but cause for awareness that additional screenings could be beneficial.
That's right. There are some tests that offer better detection in dense breast tissue. The mammogram is still important because no test is perfect. So there are findings that we will see on a mammogram that we would miss on an ultrasound or even an MRI, mostly calcifications. But really the mammogram is the only way that we see those, and those are the sign of the very earliest form of breast cancer. So we of course don't want to miss that. But masses can be missed on a mammogram when there's dense breast tissue, and there are tests like ultrasound or MRI that offer it. So it's really an additive effect where we kind of try to use all the tools in our toolbox to increase our sensitivity, meaning increase our cancer detection.
And it's really interesting that you point that out, because I'm a breast cancer survivor myself. I was doing screening mammograms, also had dense breast tissue, so would also have the ultrasound, but it was ultimately the mammogram that caught my breast cancer.
Right. It was, just a few calcifications, which would have definitely been missed on an ultrasound, and they're just not visible on ultrasound.
So really using, I love how you said using all of those tools in the tool chest. Yeah. And not neglecting our health. Ladies, that is so important. Lindsay, thank you for being here.
My pleasure.